Former Republican Senate leader Bill Frist, who has said that Obamacare is not socialized medicine, is now saying that the healthcare law is going to survive and that 70% of it is good. ALG's Frank McCaffrey spoke with ObamaCareWatcher.org's John Vinci on Frist's healthcare confidence.
John, thank you very much for joining us here. You know, there have been a number of complaints that have come up about Obamacare since it really was an idea in the president's head years ago. You deal with this law every day. What are some of the flaws that you see in it?
Well, as you know, Bill Frist just recently said that 70% of Obamacare is good and only 30% is bad, which is surprising coming from a Republican. Perhaps he's right. If you believe that healthcare is not a commodity but a natural right, or if you believe that a government takeover of healthcare is a good thing, then perhaps he's right. We would disagree with that. We would say that Obamacare has actually created a lot of uncertainty in the market in a time when we need economic certainty, in a time when we're in a what some are calling the Great Recession. Obamacare doesn't tackle the real problems of healthcare. It assumes that's big government and insurance companies that are forcing prices up. When the problem is a distorted market. The problem is that individuals individuals have no clue how much healthcare costs and are not able to make decisions on a regular basis.
John, it seems very unusual that someone who was a very powerful Republican leader just a few short years ago would all of a sudden side with the left on Obamacare, especially when you hear all these stories about people getting waivers. Why are people getting waivers?
People are getting waivers because Obamacare creates disruptions in the insurance market. And so in order to avoid those disruptions in the market, the Obama administration has had to create a number of different types of waivers. The most prevalent one, the one you hear about hundreds of waivers being offered, has to do with the annual limits requirements that Obamacare places on insurance companies. Other ones you may have heard of or may not have heard of are the medical loss ratio waivers that states have to apply to the Obama administration and say, Obamacare and this medical loss ratio is going to disrupt our market. Can you give us a waiver? And in all but one case, so far, they've been given a waiver.
Okay. Well, thank you very much, John.
For more, visit ObamaCareWatcher.org.